Good morning. This is Ed Crow. Appreciate everybody coming on today. I just wanted to wait a few more minutes before we got started as I had a number of people coming on at the last minute. So today we're going to talk about Pinnacle Financial Services quoting tools on their website, and we're also going to talk about the online enrollment called Connect for Medicare. I'm going to try to keep this brief so it's not too boring. Again, this is Ed Crow with Crow & Associates. Both these programs are available to any agencies in our hierarchy that work with us and or Pinnacle Financial Services. So we're going to try to give you an overview of them today. So first thing we're going to do is we'll go to the Pinnacle site. I think that's the easiest way to start. And we're going to show you the online enrollment tool, the quoting tool through Pinnacle's site. So the site is, if we want to type it in here, it's www.pfs, like Pinnacle Financial Services, www.pfsinsurance.com. You will need a username and password to log into the site. Anybody that has at least one Medicare contract with us can use this. So they can quote for Medicare Advantage, Supplement Part D, Life, which is Term and UL, Final Expense, Quote Engine. They quote hospital indemnity plans with all companies, even if they only have one company with us. So that's all you need. And even if you just have Medicare, you can still quote the Term and UL and the Final Expense. So one Medicare contract with us gets you access to everything. So what we're going to do is we'd go to, so once we log in, you would need a username and password. Once you have one contract with us, or even if you submit your contracting kit, you could call Pinnacle at 800-772-6881 and get set up with your username and password. So once you have that, we'll go to quoting. And we can quote annuities, final expense, long-term care, Medicare, or term and UL. We're going to start with Medicare. So we click on Medicare. We're going to go to the Medicare quoting tool. And here we can quote Medicare Supplement, Medicare Advantage, PDP, hospital indemnity, and dental. We'll go with Advantage to start. This tool is pretty easy to use, so I'll give you an idea. We'll put in a Connecticut zip code. It's good in all 50 states, however. And again, you don't have to be contracted and certified with these companies for them to show up. This will quote everything that's available through us. So I go there, and I click Get Quote. Okay, so what it's going to do is it's going to show you the plans available. I quoted Medicare Advantage plan. You could also do Part D plans only, or special needs plans. And this is not an enrollment site. It's simply a quote engine, but it will quote everything available so you can get a good idea of what's available in a given area. So you can make comparisons of these. We'll make one. We'll use WellCare. Scroll down. We'll use a Connecticut plan. Actually, we'll use one with drug coverage, so we'll use Aetna's Elite. There's Connecticut. We'll use a Connecticut plan, and we'll use the United plan. 4 plans. So we clicked on the check mark. We click on Compare Quotes. And it's going to give us a comparison. It's going to show the premium, any drug deductibles. As you scroll down, it will show you the benefits for every plan and the applicable copay to go with that benefits. It's a great way to make a comparison for a plan. Now, if you want to expand, because this is showing just a limited benefit amount, it's just showing you the basic benefits on these plans for your comparison purposes. If you want to expand that, you'd click Show All Plan Details. So if you click Show All Plan Details, then it's going to add everything else in, like acupuncture, dental, OTC benefit, really give you all the benefits of the plans. You can quickly and easily make a PDF by clicking the PDF. PDF of the plans, or you could just copy and paste and email these to people if you wanted. If you want to fill in the gaps, you can do so, and if you click Fill in the Gaps, it's going to add a hospital indemnity component to this. For us, it's going to be a couple hospital indemnity plans. I picked Connecticut, so it's only going to give us GTL, but you could add GTL. We'll do their 10-day benefit, for example. You can add it to the comparison. And there it is on the right-hand side, as you can see. As you scroll down, you can add certain riders. I can add an ambulance benefit rider. If you add it, $250 per occurrence, it's going to add the price right there. Down lower, we'll be able to add the daily benefit for this. There we go, benefit daily amount. Maybe I want to do, $350 a day. You can see that it's going to add $35.75 to the price. At the top, then it will total it up for you. So it'll show you that GTL plan with an ambulance rider and a daily benefit of $350. I think I chose is $41. It's a good way to add it to the comparison. Now, if you want, you can also do Medicare supplement plans. Again, we'll use the same zip code. Again, this is good in all 50 states. We're going to run supplements. I'll run Plan G. Get a quote. It'll quote you in order of price all the supplements. If you want to compare those, you could compare that one. So that's the lowest price Plan G. Maybe we want to do a Plan N. Click Compare. Maybe we want to do then a high deductible G. Actually, I don't think any of those are on the books yet, so bad choice. We'll do high deductible F. We will have high deductible G plans. They just aren't out yet. They probably won't be out till the 15th and showing up on the engine. We'll go with Humana. And then we can compare those plans. So again, we can do supplements. We can do Advantage plans. We can compare Part D on there. I didn't do it, but you can. I'll show you briefly also if you want to compare, you can compare final expense. The final expense quote engine is really slick. But again, you can use any of these tools. But if we want to do final expense, we'll do Connecticut. We'll do somebody born in, let's say 1950, male. We'll go male, non-tobacco. We'll do a $10,000 benefit. Get quote. And there you go. It's going to quote all the plans in order of price. Again, it's really nice, easy to use. As you can see, you got a number of companies, and it's going to give you the pricing. If you want to do level benefit, you can do that. Maybe you want to do guaranteed issue. Go ahead, click on it, hit submit. There you go for guaranteed issue plans. AIG, Gerber, simple, easy to use. Really good quote engine. The term and UL works exactly the same way. The annuity is a little more involved, and the long-term care engine's available as well. So again, you can use this quote engine. Just having one contract with us, it gives you access to everything on this quote engine at no cost. That's a quick and brief overview of how it works, but I just wanted to show you briefly just the functionality of it and how you would utilize that. Now, the other thing I'll show you since we're on here is if you go to the home page for Pinnacle. I'm doing this just because I get this question so much. If you click on AAP Toolkit, so on here, it'll give you the Medicare sneak peek, so all the 2020 benefits for the various companies. Just click on there. This is password protected. But the bigger thing people ask a lot is, you know, if you got a whole bunch of certifications to do, where do I go to do the links? Well, here they all are for a number of the companies. Not all of them, but a lot of them. So if you can't find your SilverScript link or your Oscar link, you can go here and do them. All right, so that is the Pinnacle site. It has a lot of functionality. I only showed you the quoting engine and the certification site. There's a lot more to it, but I don't want to take too much time on this webinar. I want to keep it short. So what I'm going to do now is show you Connect for Medicare, which is our online enrollment. So the website for it is www.connectformedicare.com. Okay, you have the 2019 site and the 2020 site you can access. Again, this is a separate username and password. I want to give you some details about this. Connect for Medicare is an online enrollment tool. It does not require a face-to-face meeting. There are no wet signatures on this. It's all electronic. It will quote Advantage, Supplement, and Part D plans with most of the carriers. Again, you don't need a face-to-face appointment. You can do this right over the phone or just by sending links to your clients and prospects. So it's very easy to use. Now, because this is an enrollment engine, it will only show plans you're contracted and certified to sell. So if you run this and there's a company you're not contracted and certified to sell with us, it's not going to show up on here. It can't legally, because this is a CMS-approved enrollment site. We can't have you enrolling people in plans that you're not contracted and certified for. Just wanted to make that clear. So we're going to go on the 2020 site. You log in. And here we go. Now the site works a couple different ways. First of all, if you want to send somebody just a quick quote, you just click send quick quote, if I can say it. code. Great. So we put it in a zip. We're just sending a quick quote, and we can choose from Medicare Advantage plans, prescription drug plans, Advantage plans, MAs only, and Med Sups. So any of them work. It all works basically the same way. What I'm going to do is I'm going to go with the Advantage to start. We can choose up to 3 plans. So I'll check United's Plan 3. I'll choose the Anthem Select, and let's go with the Aetna Elite PPO. Okay. Compare now. And here's what you get. So you get basically a comparison of the plans, gives you everything. You can click for the pharmacy directories. You can view details of each plan to give the specific details of each plan, if you'd like. You can send a quote to your client for each plan independently. If you want to send them a multi-plan quote with all 3 plans, you can do so. You click on there. You'd have to put in their name, phone number, and email address, and it is going to send them a comparison of all 3 plans. And if they click enroll on any of those 3 plans, they can enroll right there and then, and you will automatically be coded as their broker on that enrollment. Maybe you only want to send them 1 plan, so what you would do is you'd send quote for just 1 plan, not all 3. Same thing. If you want to click the plan details, you'd click View Details. And then you can see more details. Now, if you had entered drug information here, you'd be able to have a drug comparison which showed the total cost for drugs on this plan. Pharmacy directory, benefits, of course, enrollment form, if you need a paper enrollment form, and a benefits summary of the plan. On every screen on Connect for Medicare, if you ever need access to the physician finder for any company, drug formulary, or pharmacy finder, this one link will take you to all of them, which is really slick. So you can access all the companies, all their sites for pharmacy, drug formulary, and physician finder for all the companies, all from that one link. Really useful, saves you a lot of time. But that's how you'd send a quick quote to a client. Now, let's say you want to be a little more specific and you want to run drug comparisons to compare drug plans to see total cost. If anybody noticed on the CMS Drug Plan Finder this year, the Drug Plan Finder no longer compares the plans by total cost. It'll compare them by premium. It'll show you the cost at the pharmacy for copays, but it doesn't total it up. Last year, and that is what we would want. If you're a client or a broker, that's what you'd want, is you'd want to know, if I enroll in this plan, what's my total cost, my total spend all in, premium, deductible, and copays. CMS Drug Plan Finder no longer does that. You got to figure it out. You got to look at the premium for each plan and then add the pharmacy cost. I have no idea why they did that, but that's what they did. Makes it very inconvenient to use. With our Connect for Medicare, you can do it. If you put in the drugs in the pharmacy, it will do the total cost for the plan, including the premium of the plan and the copays at the pharmacy, plus factoring in deductibles and all those things. If you want to do that, you do start consultation. All right, we'll just make one up here. We'll put in my name. So we'll put in Edward Crow, date of birth, 2/26. I'm going to say I was born in 1950. Okay. There's everything. So I got all my information in there. Great. And I'm going to hit continue. All right, first thing that happens is your client's email address is in there. You can send them an electronic scope. So click email SOA. It's going to send them the scope, and they just click electronically to acknowledge the scope, and then that scope is kept on file in your profile for Connect for Medicare. You can save, when you do a profile or start a consultation rather, you can save every client in here, and you can save their drugs in here as well. The Medicare Drug Plan Finder will no longer allow you to do that unless you're actually logging in as the client. If you're just using the basic is a visitor part of the site, you can't save anything. On Connect for Medicare, you can do so. So we emailed the scope over. We'll hit continue. I'm just going to skip through. You can choose demographics, age bracket, health. I'm going to skip that for now. I just want to get to the drug function so you can see how it works. I'll say I'm uncertain as to, or I'll say we're not eligible for extra help. And here's where I add the drugs. So I'll put in the drug name. I'll just do a couple quick ones, atorvastatin, the generic for Lipitor. We'll throw that in there. Great. We'll throw in lisinopril with HCTZ, add, and then we'll put in Eliquis as a blood thinner, a tier 3 or 4 one at that, but we'll put it in there, add drug, just to give us a little diversity. All right, my drug list is complete. Then we can find pharmacy. The only difference here, which I would like, is I'd like to be able to put 2 pharmacies in, like on the Medicare Drug Plan Finder. You can't. Here it only allows 1 at a time. But nonetheless, we'll click our pharmacy. There we go. We went with Costco. Problem with that is you'll go there and then you'll wind up spending a couple $100s on other stuff at Costco you didn't plan on spending. But I'll try not to get off on too much of a tangent on that issue. That's not your problem. Let's hit continue. All right, there we go. So we can run this for Advantage plans. It'll show our total estimated cost. It'll have a component showing premium or showing medical costs versus drug costs. So we want to break it down for us. So we want to see the breakdown. What we would do is we do a comparison. Compare. And what it's going to do then, it's going to break down for us estimated medical costs, which isn't that predictable, honestly. It's just going based on generic utilization criteria. Estimated drug costs. If you want to see the actual drug cost, you click View Details. You could see the drug cost estimated by month. It'll break it down for you. Retail, before gap, during gap, after gap. It'll break it down by month, factor in the deductible, all those types of things. Let's go back for a minute. Where this is going to be most useful, it's useful on Advantage plans for sure, but where I think we're going to use it is now with the change, use it a lot anyways, but the changes with the drug plan finder on CMS, this right here. So this will give you, on the prescription drug plans, it will give you the total cost, like the CMS site used to and like it should. This way you know all in, if they enroll in that drug plan, what it's going to cost them, premium and copays, all out of pocket, including deductible. Total cost. So you know the WellCare Wellness RX plan is the lowest total cost at that pharmacy for this person. Makes it quick and easy. You can also do a lot of other things on here. You can do comparisons for these drug plans, of course. And of course, you know, you can send these and have people enroll through the links. So we'll compare them. Let's compare the plans. There you go. There's your comparison. And all you got to do is, if you want to send them all 3, send multi-plan quote link. It'll send them a link to click on and to enroll, or you can just send them one specific plan if you'd like. And it broke down for them their total drug cost for the year, which is right there. It says drug cost, total cost, including the premium. Makes it nice and easy. That's Connect for Medicare. You can send quick quotes to have people quote. You can start a consultation. If you do that, it will not only save your clients in there like a CRM, it'll save their drugs in there as well, which you cannot do now on the CMS Drug Plan Finder site unless the people are willing to build a profile. So I know that was a really quick overview. I should mention rather, unless they'll build a profile and share with you their username and password. Your client would have to give you their username and password to save information. Here you can do it, and you can save your clients and keep track of all of them and have them enroll right off the site. Last thing I want to show you just before I wrap up here is everybody who uses Connect for Medicare gets their own consumer-facing URL. To access the consumer-facing URL, you click My Account. Here's your consumer-facing URL link right here, copy. Okay, you click copy. There it is. That's a consumer-facing website. You could put that on your site. I have it as a link off my my actual website, and clients can go on there. They can shop on their own if they like. They can compare drugs. They can do everything. And if they enroll through there, you get credit for that sale. Let me show you an example of how we use that and how you can use it. I'm just going to go to my website, cronassociates.com. Okay, here's the Crone Associates site. When anybody goes on the site, if they click Medicare quotes, boom, it takes them right to my Connect for Medicare, personalized, consumer-facing URL. Everybody has access to this at absolutely no cost. And it's for every agent that we work with. We have other programs such as free lead programs. I'm sure you see advertisements and us promoting that. That's available to everyone that works with us, along with the quote engine, the online enrollment. So just wanted to give you an idea of how both the Pinnacle site and the Connect for Medicare enrollment works. If anybody has any questions, you can certainly call us at Crone Associates at 203-796-5403. Again, 203-796-5403. And appreciate your time today. Thank you.